Hi everyone, this is Dr. Blair Thielemeyer here, and I want to welcome you to the first ever webinar on the Pharmapreneur Academy website. So this webinar is to introduce you to our new book. It's called How to Build a Pharmacy Consulting Business, Your RX for Finding Freedom and Loving Your Career. I am so excited about this book because it's based on the fabulous e-course at the Pharmapreneur Academy. I've had a lot of great pharmacists go through. We're at 30 pharmacists now. Wow, that's crazy. 30 pharmacists that have gone through the Pharmapreneur Academy e-course and have learned how to build consulting businesses of their own. So I want to debut. This is the new book that I just wrote. It's based on the first 3 weeks of the e-course, How to Build a Pharmacy Consulting Business. And it is focused specifically on the very first steps of building your pharmacy consulting business. So in the e-course, we go a little bit deeper. We talk about how to train staff members and different protocols and procedures and putting systems in place in order to help your pharmacy consulting business grow and scale. And we also talk a lot more about marketing. This book will help. It's a low cost entryway. It's $19 for the paperback version. It's $9.95, I believe, for the Kindle version. And it's a low cost way to see a little bit of what it would look like to join the Pharmapreneur Academy and what you would learn in there, and a little bit of introduction to my teaching style. So before we get started talking about some of the results that other pharmacists have seen through the Pharmapreneur Academy, through my coaching program, and also the e-course, first I want to talk a little bit about my story, how I got started consulting, and also what my goal is with the Pharmapreneur Academy. So my story started back in April of 2014. I was working full-time at a local community hospital as a clinical pharmacist, and I was 6 months pregnant with my first child. And everything was going well. I was saving up for my maternity leave, and I was getting everything ready for the baby to come. And all of a sudden, due to some budget cuts, they had to cut my job and title back to PRN. So that meant that I would no longer be receiving benefits at all through the company. So I lost my insurance. I lost the deductible that I had paid up to my pregnancy, my OB at that point, and all of my prenatal care. So financially, that hurt, but emotionally, I was devastated. I was very scared that with the baby on the way, that I would not be able to find another job quickly enough. And if I did, who wants to hire someone that's 6 months pregnant, right? They know that I'm only going to be there for 2 or 3 months, and then I'm going to be on maternity leave. So I was extremely nervous that I wasn't going to be able to make up the slack. So what I did was started calling around my network, going door to door in community pharmacies, because community pharmacy is where I did all of my training. So I had a lot of contacts in independent community pharmacy. So I started calling around and calling upon my network and asking if anyone had any extra relief work. In doing that, I was able to pick up enough hours to make it until my delivery and after my maternity leave. And I was able to get on my husband's insurance too, even though we did have to pay the deductible over again. But so that worked out. But after the baby came, then I started looking at full-time positions. And I didn't find anything in my area that interested me. And I was also a little gun shy to take another full-time position. Um, Basically, I felt like I was putting all my eggs in one basket and relying on one single employer to provide for me and my family. So I like doing relief work, and I decided to just continue staying a PRN pharmacist. Well, in the meantime, one of the community pharmacies I was working with asked me to start managing their MTM program. And I was reluctant at first, but I decided to go ahead and do it. And since then, I have decided that I really love doing MTM consulting in different pharmacies. And so that's what I've been doing since then. So these are my whys, and these are the reasons that my husband Chad and my daughter Avon, these guys are the reasons that I have decided to share my message about the advancement of pharmacy, because I know there are so many other pharmacists out there like myself that have entrepreneurial aspirations and are looking for something else. They're looking to use their clinical skills. They're looking to advance the profession. They're looking to find many different things in the profession of pharmacy. When I first started looking for relief work, I tried Googling online pharmacist jobs and looked into a lot of different online type of work. And once I found out that I could become a consultant here in my local area, that seemed to really fit with what I wanted to accomplish with my career and also with my lifestyle and with my family. So now my question for you is, what is your story? Is it that you just have a passion for patient care, that you're wanting to get out of the traditional dispensing role? Or do you like the job you're in now? Are you just wanting to provide a little bit of additional income each month? And you can easily do this 2 hours a week getting started to provide additional income and have a little bit of a side business. Is it for freedom? Because I work 2 days a week from home now, and I split my time between writing books and creating online courses and doing stuff in my online business and consulting for pharmacies here in my local area and seeing patients in the pharmacy. Is it because you want a new challenge? Is it because you feel like in your job you've reached the glass ceiling? I mean, once you get to director of pharmacy or pharmacist in charge or pharmacy manager, where can you go from there? You feel like your salary's capped out? Do you feel like there's no more challenges for you in your career and you're only midway through your career? Are you just looking for something else to challenge you and challenge your ideas about pharmacy? I really want to know. I really want to know what your story is and what your why is. So if you are enjoying this and you want to share, you can tweet me at BT Pharmacy or email me through the btpharmacyconsulting.com site. I would love to hear your whys and what your story is. But I'm going to share a few other stories with you today. And if you will stick around until the end of this webinar, I have a special bonus for you. And I think you're really going to like it, especially if you like to read. So case number one, Michael. I began working one-on-one with Michael. He was working full-time in a hospital pharmacy, and he was looking for something else. He was looking for being able to create some kind of consulting business on the side with his wife, something that would begin generating a little bit of extra income and allow him to step back from his full-time position in a hospital pharmacy. So when he and I first started working together, he had one lead, and I coached him through following up with that lead and kind of what to say and the marketing and how the contract would work between the two of them and how he would be reimbursed for his services. Well, within 3 weeks, he had a yes from that pharmacy, and he was able to decrease his hours to part-time in order to focus on his business. Since he got that one lead, he now has 3 pharmacies that are interested in hiring him for his services. Now, usually, to create a pretty good part-time salary, I do recommend having between 2 and 3 pharmacies that you are consulting for each and every month. And a full-time position, I have a colleague in Northwest Arkansas who does 9 pharmacies, and that's a full-time position for her as well. So here's what Michael said about his results. The 2 most significant things that he learned from the Pharmapreneur Academy program was how to charge for an MTM and how to set up pharmacies on the platforms. Now, he's referring to the Outcomes MTM and the Marixa platforms. And I actually walked him through a demo of the Marixa platform just to show him how to go through the patient queue and how to schedule everybody and that sort of thing. So he sent me a note once they got set up that he said there were 90 patients that needed review in one pharmacy. So to give you an idea, that 90 patients, that between $50 and $75 per patient is what the pharmacy is going to see in reimbursement. And I recommend that a consultant would charge between $75 to $100 per patient to do the consulting services. So that gives you a little bit of an idea about how much revenue you could generate with 90 patients. Michael said, it's actually a little overwhelming because my contact person keeps telling people about me. He said, I have 3 more pharmacies lined up for you. And so Michael has had great results. I'm so proud of him. He has worked so hard, and I'm really excited to see the things that he's going to do in his business this next year. I feel like he could even cut back even further in his hospital position, in the next 6 months or so. So most people ask about pharmacy consulting for community pharmacies. This is how I got started, and this is the questions that we answer in the new book. How do I get started? What do I charge? How do I market my services? How do I organize these services and create systems that will help? So these are the types of things that you will learn in the book, and we will go into further detail in the Pharmapreneur Academy course, should you choose to do that, about how to organize your services and train pharmacy staff members to help you with those services. So different opportunities for consultants. I focus mainly on the consultants in community pharmacies because I do believe it's the path of least resistance at this time until we get provider status and get some other models created. It's the best for an independent consultant. Now, there are opportunities for consultants in affordable care organizations, group practices, home health organization, long-term care facilities, and even cash-paying groups of patients, like diabetic support group patients or patients in a retirement community or patients wanting to pay for pharmacogenomic tests. So these are opportunities. And I think that once you get a little bit of experience under your belt, that these things will really make sense for you to add to your consulting toolbox, as I call it in the book. So case number 2, Nicole. Nicole went through the online course at the Pharmapreneur Academy. She worked as a director of pharmacy for a skilled nursing facility. She was lucky to facilitate many connections with different physicians and different home health agencies and different providers because of her interactions with them as a director. So she was already doing a little bit of consulting for community pharmacies, but she was not sure really how to move forward. She was getting hung up on billing and marketing. So we talk about that in weeks 4 and 5 of the, we talk about marketing in week 3 of the Pharmapreneur Academy e-course. And then we talk about training in weeks 4 and 5. So now she is working with physicians in a group setting. I believe she said she had 3 different physicians she's working for. So here she said, I had been working with a collaboration of 9 pharmacies and teaching consulting within their pharmacies on workflow, business improvement, and how to incorporate synchronization and its value into their independent pharmacies. This course allowed me to feel confident, get organized, and approach them with opportunities to do their MTM, train on MTM, and most excitingly, consult in their clinics with a collaborative practice agreement. Today, I consult with 3 outpatient clinics monthly, and am working on a copyrighted super bill for each clinic. This course opened my eyes to the multiple opportunities I had never even considered previously. So again, Nicole's results were just amazing. I was so proud to hear that she was able to move then out of community pharmacy consulting and into physician consulting. And that's another thing we talk about in the book, is identifying where your passion is, where your target market is going to be, and being able to focus on those specific leads. So pharmacist consulting for group practices can get reimbursed for their services in a few different ways. The Incident 2 MTMs are not pharmacist specific, but those are the 99211 through 99215 codes. Pharmacists can also help group practices set up chronic care management services and also transitional care management services. There's a couple different pieces of software that allows pharmacists to collaborate with these physician groups and meet Medicare compliance regulations for these types of services. So if you're interested in that, I can provide you some more information with different software platforms that will allow you to do that. So another thing, why would a pharmacist want to work for a group practice, or why would a group practice want to hire a pharmacist? Well, pharmacists are proven to improve patient outcomes and are now being looked at in accountable care organizations for cost control reasons. So we can stretch the bundled payments and also improve the reimbursement because of the pay for performance models. So as we're looking down the pipe, we're seeing that pharmacists are really helping patients and providers in the end goal. So we're offering also innovative new services such as pharmacogenomic testing, and that's something that a pharmacist who's acting as a clinical care coordinator in either a group practice or a home health organization or something like that can offer. You're always on the lookout for new things that you can offer your patients and offer in the services. And sometimes physicians are just too dang busy to be able to do it. and don't want to spend the time or research doing it. So pharmacists, we're good at research, we're good at organizing people, and we're good at creating organized care coordination services. So I think that this would be a really great option for somebody who's interested in offering kind of an all of the above model. So case number 3, her name's Carol. We worked one-on-one last fall, and she was working as a remote order entry pharmacist for a local hospital, and she has many contacts in the home health care industry. She was most interested in nutrition and preventative therapy. So Carol works in a very affluent community, a lot of retired people, and a lot of people that would be willing to pay cash for her services. So she and I worked on a cash paying model in addition to her consulting for home health agencies and group practices. Okay, here's what Carol had to say about her results. I found out the billing codes and all the different areas I can market my services. Marketing was my problem, and I was able to reach a bigger audience from the infographics and flyers I created. I passed them out and used them on social media. The codes gave me confidence to approach a physician and offer my services. I changed my focus from home health to pursuing physician collaborations, independent pharmacies, health clubs, senior groups, or homes and individual patients. So I'm very proud of Carol. She's working on a cash paying model and working on marketing directly to patients in her area. So I promised you a bonus if you stuck around till the end. If you will go to btpharmacyconsulting.com/sneak peek, you will receive the first and last chapters of my book for free. It's in a downloadable PDF, so I want you to go and download it and read up and find out, is the book right for you? Is pharmacy consulting something that you think you would enjoy doing? And let me know. And if you do enjoy the book and what you read here, I would so appreciate a review. A review on Amazon is like gold to me because that helps me reach even more pharmacists. So again, I really thank you for being here. And if you have any questions, feel free to reach out to me through my website, btpharmacyconsulting.com. And be sure you're on our newsletter so that you can stay up to date for any new information that comes out on MTM and clinical pharmacy services. Thanks so much and have a great day.